The CDC says unvaccinated teens are 10 times more likely to be hospitalized with COVID-19 compared to those who have been fully vaccinated. Those findings are based on data from hospitalizations in 99 counties across 14 states. According to the American Academy of Pediatrics, more than 200,000 coronavirus cases in children were confirmed just last week. Only children aged 12 to 17 are currently eligible to receive a vaccine. For more on all this, I want to bring in Dr. Taison Bell. He's a critical care and infectious disease physician and the medical ICU director at the University of Virginia. Dr. Bell, always a pleasure having you on the show. How does this data from the CDC underscore the need for eligible kids to get vaccinated?
Well, thanks for having me on, Lana. And yes, these studies, there were two studies released by the CDC. They really emphasize the importance and power of vaccination to keep children healthy. As you reported, adolescents 10 times more likely to be hospitalized if they were unvaccinated. We also saw that higher hospitalization rates were seen in children that were at or below 4 years of age, who, of course, are not eligible for vaccination yet. But another finding that they saw were that states that had the highest rates of vaccination, children of all ages were 4 times less likely to be hospitalized. So you see the power that vaccines have to keep children safe, in addition to our mitigation measures. And the main takeaway is that if we want to keep children safe, we have to make sure we vaccinate all eligible people, children and older children and adults that are around them, in addition to mitigation measures like masking indoors. But this was a powerful study showing that we can keep children safe. We just have to vaccinate, and keep up with our mitigation measures.
And what measures should parents be taking if their kids can't get the shot, either because of age or another health reason?
A good question. And this is my situation. I have 2 young children, one who's in preschool and one who's in 2nd grade. We make sure that they are universally masked. We have asked about the staff vaccination rates among the faculty and staff in the places, the buildings that they enter. And they have good policies around hand washing, circulation in the classrooms, HEPA filters, et cetera. It's really a layered approach. You can't just rely on one of these measures. You really want to stack them on top of each other, because that's how we really increase or decrease the chances that virus will circulate in classrooms. Inevitably, we will have cases that pop up. Just that's the nature of the virus. But with these mitigation measures, we can keep the chances that it'll spread to other children and other adults very, very low.
Let's talk about booster shots. The federal government's plans for booster shots are facing some new hurdles. One source tells CBS News that the Moderna shot will not be available as a 3rd booster later this month due to insufficient data. Pfizer is still on track, though, as we understand it, for approval. So what exactly are the FDA and CDC looking at before they approve these additional doses?
Well, the FDA has always indicated that they want to lead with the science and review the data as it comes in. And I think there's a couple of things to consider. So a lot of the data that's driven the decisions around boosting in the United States has centered on data coming out of Israel, and they heavily relied on the Pfizer vaccine. So we have a lot more data when it comes to the population benefits of potential boosters. So we have a little less for Moderna and Johnson & Johnson. I'll include in there too. There are also a couple of studies, one out of Belgium and another at my institution, that did show that Moderna compared to Pfizer did result in higher antibody levels. Now, it's important to remember that antibodies are just one part of the equation when it comes to immunity. But what we have seen are that antibody levels do correlate and track with your ability to protect yourself from symptomatic disease and from severe COVID-19. And you can think about it as a hurdle that you have to clear. So first hurdle being hospitalization and death, so severe COVID-19. All of the approved and authorized vaccines have very good protection, even over time, from severe COVID-19. The second hurdle, which is a higher hurdle to clear, is symptomatic disease. And that's really what the boosters, at least at this point, are designed to protect ourselves from. Now, we've seen over time that although it starts off high, those levels can drop and go below that threshold. But what's important to remember as we're considering boosters and having potentially different timelines is that the vaccines are still very, very good when it comes to clearing that first hurdle and keeping people protected from severe COVID-19.
This current surge is being fueled by the Delta variant, which is in so many ways worse than the original COVID-19 that we were faced with early on in the pandemic. And now health officials say that they're keeping a close eye on a new variant dubbed Mu. What more can you tell us about this strain, and how concerned are you about this?
Well, I think when any new variant emerges, we do have to pay close attention to it. And I think, we can all probably share and we're learning more about the Greek alphabet than we would like to. But this is a variant that emerged in Colombia in January of this year. It's been confirmed in 39 states, including in 39 countries, including the United States. And it's the fifth variant of concern that's being investigated by the WHO. Now, it does have a constellation of mutations that could mean that it could potentially evade immune responses that are either induced by the vaccines or by natural infection. But it's important to recognize that this is laboratory data. There's actually not a lot of clinical data yet so far to suggest how this may behave in relation to other variants. And it's actually hard to predict based on which variants and mutations a variant has, how it's going to behave in the community. So we'll have to keep an eye on this. But I think this underscores that as long as we have significant portions of the globe that are unvaccinated, we're going to have these variants keep popping up. And luckily, we have good protection from vaccines from the variants that we know so far. But, that may change over time. And now Colombia is a country that has just a little over a fourth of its population vaccinated. So if we continue to have countries that have low vaccination rates, this risk of having more variants will just continue.
All right. Dr. Taison Bell, thank you for joining me, answering all my questions, and thank you, of course, for all that you do.
Thank you.